Precision medicine means that we use the right drug to the right patient.
Precision medicine is a match, and it's a kind of three-way match. I think we've got a therapy, drug, we've got a patient, and we've got a cancer. So by evaluating each of those spheres, the three things, putting them together, we get the most precise match we can.
Precision medicine is coming in a direction which is very much fascinating for several reasons. First, we are speaking of precision diagnosis, which means that in all tumor types, including gastrointestinal stromal tumors, of course, but also lung cancer, breast cancer, whichever tumor, you are in a situation where you see new nosological entities appearing amongst what was thought to be a relatively homogeneous group of tumors.
So this idea that every patient's treatment plan is individualized is continues to be so important in lung cancer. So taking a patient that comes into your clinic, not only reviewing what's unique about them, but what's unique about the tumor.
I think it's very important. We have entered the area of personalized or precision medicine. What it really means is that we have identified certain biomarkers in a tumor. And I think it's very important to distinguish two major biomarkers. One are predictive and one are prognostic. And how they are used are completely different.
It's an interesting term because it essentially encompasses what doctors have been doing for, or trying to do for the last, I guess, 2 centuries. But now, with our ability to understand a cancer genome in greater detail than ever before, we have what are called next generation sequencing machines, large aluminium machines that sit on a large sort of kitchen worktop, if you like, that can sequence a whole cancer genome in under a day.
Predictive biomarkers, which we have now in colon cancer, will predict the efficacy of a very specific treatment. So when you have these biomarkers, you should or you should not get this particular drug. That is prediction.
Each tumor is like the key at your home. You have your own key to get in. Precision medicine needs that you will attack the tumor cells by being able to block this very specific key for your own cancer.
Prognosis is a different, we have actually 2 prognostic biomarkers. One associated with very good outcome and one with very poor outcome. Now it's very important to know these markers on prognosis because sometimes screening and how we follow up these patients may change if we know this tumor may be more aggressive. The good news is whenever we have prognostic markers, these are very good targets. So I think it's a very exciting time where we have growing understanding of molecular makeup of tumors, and we are seeming to match up better and better our treatment options, that we align molecular makeup with the best treatment.
It's not absolute precision for each individual patient, but it goes in this direction. And the mechanisms are very much more comparable to this mechanism than what it used to be in the past. In the past, we used to have a blunt approach, trying to destroy everything with chemotherapy, which is still quite active, very active in some tumor types. But here we are starting to be more subtle. Not only to destroy the door, but to unlock the door using the proper key. That's precision medicine for the patient.
It also diminishes the chance of having to go through therapies that are useless and are only going to produce side effects and waste time. So I think that's the precision.
It is important also to have a supportive care permitting patients to receive this kind of therapy, because also the target therapy can have toxicities. For example, skin toxicity or toxicity in the liver, in the lung, and so on. So there is, in my opinion, a continuum of care. We need precision medicine and we need optimal supportive therapy in order to give the patient the best therapy.
And if you think about those breakthroughs in the last 15 years, and one can only imagine what's going to happen in the next 15 years, as we'll be approaching, benchtop USB drive sequencing approaches where we'll literally in real time get a sequencing result back on a computer screen in front of the patient there and then in clinic, potentially. And that would not surprise me in 10 years' time if we're there.